Hi, I am Dr. Domenico De Rose, a neonatologist from Bambino Gesù Children's Hospital in Rome, Italy. Bambino Gesù is a specialistic research hospital for pediatrics and neonatology, with a total of 600 of beds, 60 of whom are in the neonatal department. I'm going to present a study on the healthcare-associated infection in surgical infants in 13 Italian neonatal intensive care units before and during the COVID-19 pandemic that we performed to evaluate the impact of protective measures adopted to prevent the spread of COVID-19 on the incidence of healthcare-associated infection in a cohort of critically ill newborns. During the COVID-19 pandemic, we were obliged to reshape ordinary admission to our neonatal intensive care units to avoid the spread of severe acute respiratory virus 2, the SARS-CoV-2, to high-risk infants. The implementation of these prevention procedures in our NICUs in Italy have affected the environmental circulation of pathogens other than SARS-CoV-2, resulting in changes in the incidence of healthcare-associated infection. In this study, we described the impact of pandemic-related protective measures on the incidence of bacterial and fungal sepsis in neonates and infants who had been hospitalized to undergo major surgery in 13 Italian NICUs before and during the COVID-19 pandemic. From 2018 to 2021, we compared the incidence and risk factors of bacterial and fungal nosocomial sepsis in the pre-pandemic period and during the pandemic period, from October 2018 to February 2020 versus March 2020 to May 2021 in 541 infants. In particular, the 60% was born in the pre-pandemic period and the 40% was born in the pandemic period. In total, we registered 2,044 infections in the pre-pandemic period and 156 infections during the pandemic. As we can see in the figure, the incidence density of an infection decreased significantly in the pandemic period compared to the pre-pandemic period. We passed from 60 per 1,000 patient days to 13 per 1,000 patient days in the pandemic period. Exploring risk factors of healthcare-associated sepsis, we found a significant difference with a marked decrease in the frequency of use of anti-acid, antibiotics before surgery, and days of central vascular catheters during the pandemics. And these were the conclusion of our study. Our results support that the containment of catheter days, the decrease of administration of antibiotics before surgery, and of the proton pump inhibitors, these three led to a significant decrease in the incidence of healthcare-associated infection in the involved 13 intensive care units in Italy during the pandemic. Therefore, the correct use of these drugs and the rapid removal of all central lines are crucial. And then, the changes in the incidence of bacterial and fungal infections in our cohort of surgical neonates and infants before and after the pandemic appear to be related to the procedure, contributing to healthcare-associated infection. The implementation of hand washing, isolation precautions, and regular use of gloves may have had the effect of bundles and contributed to the observed difference in the incidence decrease during the pandemic. Nosocomial infection can be abated if hand hygiene compliance, the personal protective equipment, and the appropriate antiseptic procedures and correct isolation precautions are encouraged and reinforced. If you had any question for me, please contact me during the conference through the platform, and you can also contact us at these email addresses.